I am Eleanor, and every day I witness the silent suffering of elderly people who enter the hospital expecting care but are treated with disregard simply because they don't have financial means. I see it, I feel it, and I am moved by this reality. They are not seen as people, but as numbers. Today, I will tell the story of one of these elderly individuals, someone who, like so many others, has been forgotten by the system, but whose pain cannot be ignored. The linoleum floors of the regional hospital felt colder than the Manchester winter outside. He stood there, his coat frayed, a man instantly filed away by the hurried staff. Every averted glance, every drawn-out delay cemented the verdict they'd already reached: negligible. They saw only the surface, the quiet assumption of second-class status. But beneath that unassuming exterior beat the heart of a man who understood the Hippocratic Oath intimately, a man who knew precisely how high the stakes truly were, even when nobody was listening. That silence, however, was about to become the loudest sound in the ward. The air in St. Jude's Regional Hospital, Manchester, always smelled of industrial disinfectant and the faint, lingering scent of boiled cabbage. It was October 14th, 2024, and I, Arthur Pendelton, aged 78, found myself navigating these echoing corridors, my slightly stooped posture and my worn tweed jacket serving as instant, damning evidence of my station. I felt the shift immediately upon approaching the admissions triage desk. "Name?" Graham Bell asked, his tone utterly devoid of inflection, a sound polished smooth by bureaucratic indifference. "Pendelton. Arthur Pendelton." I kept my voice level, a habit ingrained over decades of commanding operating theaters, though now it sounded thinner, quieter than I intended. He tapped at the keyboard with a deliberate slowness that felt overtly condescending. "And the nature of your complaint today, Mr. Pendelton, be precise if you wouldn't mind. We're rather busy." I explained my dizziness and intermittent breathlessness. It was likely nothing, perhaps a minor arrhythmia, something easily managed. But the way Graham Bell listened, or rather failed to listen, was the real malady. He scribbled something brief on the electronic form, not meeting my eyes again, and waved a hand vaguely towards a seating area. "Ward C. Wait for the nurse to call you through triage. Don't wander off." The waiting area for Ward C, the geriatric section, was a tapestry of muted colors and subdued discomfort. It was here that the next layer of my slow humiliation began to unfold. The staff moved with a frantic energy, but the direction of that energy seemed inversely proportional to the urgency of the patient awaiting attention. Those patients who looked put together, visitors in designer coats perhaps, or relatively younger individuals, were ushered swiftly. I, sitting quietly, waiting patiently, seemed to fade into the beige wallpaper. Nurse Fiona Davies, 24 years old, and radiating the sharp, unyielding efficiency of a freshly starched collar, finally called my name. She held my chart, my patient file folder, as if it were mildly contagious. "Mr. Pendelton." Fiona Davis's movements were sharp, economic. She steered me not to a proper consultation room, but to a cramped, curtained-off area usually reserved for quick checks. As she took my temperature and blood pressure, her focus was entirely on the machinery, not on me. I simply nodded, biting back the retort that I had, unsuccessfully, to secure an appointment with my own doctor for 3 weeks. I watched her log my readings. She marked my presentation down, I noticed, when she briefly angled the clipboard away from me, as non-specific complaints, likely anxiety. It was infuriating. I could feel the weight of my years of medical training, the long nights studying hematology, the years spent as a consultant surgeon, the very respect I had earned from colleagues across the continent, being systematically erased by the cut of my tweed. Days blurred into a cycle of routine checks that felt more like surveillance than care, and dismissive interactions. I was Arthur Pendelton, the elderly gentleman in the shabby jacket, Not the man who once delivered seminal papers on reconstructive surgery at the Royal College of Surgeons. Then came Dr. Alistair Thorne, 35 years old, whose scrubs looked as if they had been tailored specifically for his angular frame. He strode onto Ward C like a conqueror surveying his domain. His confidence bordered on hubris, a trait I recognized from my own early career, yet his lacked my mitigating caution. Dr. Thorne reviewed my chart, which was now layered with Fiona Davis's subtle downgrading notes. He spent perhaps 90 seconds with me, barely looking into my eyes, his attention snagged by a persistent flicker on the cardiac monitor near my bed. "Still feeling off, Mr. Thorne asked, his tone dripping with the polite condescension reserved for those who are deemed hypochondriacs. "Well, monitor you. If you manage to keep fluids down, we might consider discharge by the weekend. Don't worry your head about the technicalities." I wanted to scream that I understood the technicalities better than he did, that I could recite the latest protocols for atrial fibrillation backwards while performing a tracheostomy, but I held my tongue. I was the patient now. I had ceded authority by the simple act of wearing a hospital gown. The pivotal moment arrived on the 5th day. It was late afternoon, the ward noise level peaking as junior staff changed shifts and visitors arrived. A sudden, sharp alarm pierced the din. It wasn't one of the regular monitoring beeps. It was the code blue. A sudden, catastrophic cardiac event. The nearest patient, an otherwise robust man in his late 60s, had collapsed, unresponsive. The immediate response was chaos, precisely the sort I had spent a lifetime training staff not to exhibit. Thorne and Fiona Davies rushed over, followed by 2 other nurses. "Get the crash trolley," Thorne barked, his composure momentarily fracturing. "He's failing to respond to adrenaline," Fiona reported, her voice tight with panic. Thorne looked wildly around the small group. "The defibrillator? Where is the emergency defibrillator unit?" Someone pointed towards the wall cabinet. The unit was retrieved, but as Thorne prepared the pads, he hesitated, peering at the settings as if encountering the machine for the first time. This delay, a matter of critical seconds, felt like an eternity. My carefully constructed silence finally shattered. The sight of a life being needlessly jeopardized by uncertainty was a trigger stronger than any perceived insult to my worn jacket. "Dr. Thorne!" My voice sliced through the rising panic, carrying the resonance of years spent lecturing postgraduates. It was louder, deeper, unequivocally authoritative. Both Thorne and Davies froze, turning to look at the source of the interruption, the old man in the tweed-associated corner of the ward. Thorne bristled, turning back to me, his face a mask of offense mixed with confusion. "Pendelton, you need to remain in your bed. This is not your concern." "On the contrary, doctor," I countered, swinging my legs over the side of the bed with a speed that betrayed my internal energy. I walked towards the makeshift resuscitation circle, my slight stoop forgotten. I ignored Thorne completely, speaking only to Fiona Davies, whom I noted had managed to secure the airway but was struggling with suction. "Nurse Davies," I commanded, "suction now. Clear the field. Thorne, step aside. You're contaminating the sterile zone you've created. Give me the pads." I snatched the emergency defibrillator unit from Thorne's stunned grasp. My hands, though aged, moved with an ingrained muscle memory forged over decades. I slapped the pads onto the patient's chest with firm, precise placement. I didn't bother with the automated prompts. "Charging to 200 joules. Clear," I yelled, looking only at the faces I knew were watching from the doorway, including the imposing figure of matron Eleanor Vance, 55, who had apparently arrived silently during the height of the chaos. I depressed the charge button. A sharp crack echoed as the necessary energy jolted the patient back into a recognizable sinus rhythm. Within moments, the man stirred, beginning shallow, then regular breaths. The silence that followed was heavier than the air before a storm. Thorne stood slack-jawed, the color draining from beneath his tailored scrubs. Nurse Davies stared at me, the condescension replaced by stark awe. I straightened up, placing the defibrillator back on the trolley, the adrenaline beginning to recede, leaving me suddenly very tired. I turned to face the stunned assembly, the only person who looked entirely unsurprised being Matron Vance, whose stern expression seemed to be calculating the precise damage to the hospital's reputation. The humiliation was now entirely theirs. I looked at Thorne, then at Matron Vance, waiting for the inevitable awkward fallout. They had judged the book by its worn tweed cover, and in doing so, nearly cost a man his life. The silence held until Matron Vance finally stepped forward, her voice low and dangerously controlled. "Thorne, Nurse Davies, my office, now. Pendleton, if you would kindly return to your bed." I believe we have a great deal to discuss regarding the standard of care administered on Ward C today. I walked back to my bed, the exhaustion settling in earnest. The sterile corridors of St. Jude's suddenly felt very different. I had revealed myself, not to regain status, but because the ethics of my profession demanded intervention against incompetence. The judgment had ended, replaced by a stark, uncomfortable accountability, a confrontation they were ill-equipped to handle, especially when faced with the ghost of their own prejudice standing before them in a pair of old pajamas and a shabby jacket. The shock in the room was palpable, a sudden, cold vacuum where frantic activity had reigned moments before. Matron Eleanor stood framed in the doorway of Ward C, her customary rigidity now strained by disbelief. She surveyed the scene, the elderly patient, Arthur, standing calmly beside the miraculously stabilized man, and the two senior staff members, Thorne and Fiona, frozen mid-crisis management. Eleanor's voice, when it finally cut through the silence, was dangerously low, pitched just for the three of them. "Thorne, Davies, my office, immediately. Arthur, please, return to your bed. We will manage the follow-up here." Arthur nodded curtly, his gaze unwavering as he walked past Thorne. The younger doctor looked like a statue carved from mortified flesh, unable to process the reversal of authority. Fiona, however, was visibly shaking, clutching the suction apparatus as if it were a lifeline. As Arthur settled back onto the scratchy sheets, an aide, a young woman who had barely spared him a glance for days, approached with a fresh glass of water, her movements now imbued with an almost reverent caution. Arthur took the water, but his focus was entirely on the drama unfolding behind the privacy curtain that Eleanor had hastily ordered drawn around the recovered patient. Thorne emerged first from Eleanor's makeshift conference, his tailored scrubs suddenly looking less like high fashion and more like a costume he had rapidly donned for the wrong play. He avoided Arthur's eyes entirely, moving stiffly towards the desk, presumably to begin compiling the incident report that would either save his career or utterly demolish it. Fiona entered next, her sharp uniform looking rumpled. She stopped beside Arthur's bed, not summoned, but drawn by a need for some kind of absolution. "Mr. Pendelton," she began, her voice barely a whisper, stripped of all its former official sharpness. I am truly sorry. I had no conception." Arthur looked at her, truly looked at her, seeing past the starched collar to the scared young woman underneath. Conception of what, Fiona? That an old man might still possess his faculties? She winced, the observation hitting its mark. It was the jacket, wasn't it? The way you presented at triage? Graham just noted you down as a likely non-emergency referral. Graham Bell, Arthur sighed, the name tasting dusty. The gatekeeper of perception. Yes, the jacket, the slightly worn shoes. I presented as someone who couldn't afford private insurance, someone whose time was expendable. I was categorized before I uttered a single symptom. That, Fiona, is the malaise of modern medicine when efficiency trumps observation. He leaned forward slightly, finding an unexpected clarity now that the pressure of silence was lifted. When I was training, we were taught to look beyond the textbook presentation. We were taught to look at the patient, not the chart, and certainly not the fabric they wore. I remember a time when a consultant arriving to teach a lecture was treated with a minimum of respect, regardless of their journey from the train station. Here, I might as well have been asking for directions to the nearest charity handout. Just then, Eleanor returned, her expression unreadable, suggesting a professional mask firmly reapplied. Thorne remained near the periphery, silent, sullen. "Arthur," Eleanor began, using his first name with a calculated intimacy that signaled the shift in their relationship. "I have spoken with the attending consultant for Mr. Odom. They are confirming the successful resuscitation. You undoubtedly saved his life. There is no question of that." Arthur merely inclined his head. "I did what was necessary, Eleanor. That is all." "Necessary," she echoed dryly. "It was also necessary that you felt compelled to override a doctor managing a critical event. Thorne is proficient, Arthur. He is merely overconfident in his recent training. He underestimated the situation, yes, but your intervention was highly unorthodox." He gestured vaguely towards the dusty corner of the ward, a place that felt miles away from his former sphere. "I recall having an office once, years ago, in the old wing. A small, functional room overlooking the back entrance. I used to review referrals there. Never once did I make a preliminary judgment about a patient's need based on a note indicating a threadbare coat. I reviewed the pathology." Eleanor walked closer to the bed, her eyes softening almost imperceptibly, a momentary crack in the matron facade. "We are investigating the triage procedures. Graham has been pulled in for questioning. Thorne will be undergoing remedial training this week. I assure you, Arthur, this hospital prides itself on its standards. What happened today exposes a deep flaw we must address." "It is not a flaw, Eleanor," Arthur corrected gently. "It is a culture, a symptom of a system that assumes status is quantifiable by salary or youth. You hire people who are excellent diagnostically, perhaps, but who lack the basic human empathy to see the person behind the paperwork." He looked directly at Thorne, who flinched under the direct scrutiny. "Doctor, you nearly lost that gentleman because you assumed my input was noise pollution. You dismissed the quiet man because he looked like he belonged in the pauper's ward, not the theater review. Learn this lesson well. In medicine, appearance is the most dangerous diagnostic error one can commit." Arthur leaned back against the pillows, the adrenaline fading fast, replaced by a profound weariness that had nothing to do with his initial symptoms. He felt the weight of his 78 years settling back onto his shoulders, heavier now that the fight was over. Eleanor understood the dismissal. It was complete and absolute. She nodded slowly, a rare concession to his silent authority. "Consider it done, Arthur. We owe you more than a simple discharge." As Eleanor steered a chastened Thorne away, Fiona lingered, her eyes filled with a complex mix of regret and burgeoning respect. She reached out, hesitating, before lightly touching the edge of the worn tweed jacket draped over the bedside chair, the object that had dictated his entire experience. "I hope to see you well, Mr. Pendelton," she murmured, before hurrying to catch up with the matron. Arthur watched them leave Ward C, the echoes of their hurried footsteps fading down the long corridor. He was once again alone, an elderly patient in a hospital bed, but the air felt different now. It felt thinner, cleaner, perhaps scrubbed clean by the necessity of truth. The judgment was over, replaced by a stark, humbling clarity for those left behind. He closed his eyes, the ordeal concluded, the respect finally earned, albeit through the most regrettable circumstances. The corridor outside Ward C was now quiet, the usual frantic energy of the nursing station subdued. Arthur sat on the edge of the trolley they had wheeled him to, waiting for the paperwork that would secure his release. He watched Graham, the receptionist, being led away by a stern-faced administrator, his usual air of bored indifference replaced by a look of profound bewilderment. It seemed the ripple effect of the near tragedy was still spreading through the lower echelons of St. Jude's. He still wore the worn tweed jacket. It lay across his lap like an accusation. It was the physical manifestation of every slight, every delay, every whispered assumption that had been made about him since he walked through the automatic doors yesterday. He adjusted his spectacles, the simple act feeling significant, like settling the score of a long unseen battle. Eleanor returned, her gait slower now, less military. She carried a single, thin discharge folder. Arthur nodded, waiting. He knew this was not merely an apology. This was the matron conducting an internal audit of her own damaged authority. Graham, Eleanor continued, her jaw tight, will be reassigned immediately. He failed to escalate your concern based on established protocol, irrespective of presentation. He claimed you were evasive about your contact details, which is manifestly untrue given the data we now possess. Evasive, or perhaps just unwilling to supply information to someone who clearly believed I was wasting their time? Arthur countered, his voice flat. He watched Eleanor absorb the critique. He was no longer a patient seeking treatment. He was a tribunal. And Alistair? She said, the name laced with profound disappointment. He is facing a formal review regarding patient management and professional conduct. He admitted to overlooking the critical vital signs in favor of pursuing a diagnosis he deemed statistically more probable for a man of your apparent demographic. Arthur allowed a small, humorous smile to touch his lips. Demographic. Yes, that charming, modern shorthand for poorly dressed and therefore low priority. Alistair confused probability with certainty, Eleanor, a fatal flaw in any discipline, but catastrophic in ours. He saw a frail old man presenting with vague chest discomfort, a textbook low-risk presentation, and he failed to look for the shadow lurking behind the common presentation. He failed to consider the exceptional. You are the exceptional, Arthur, Eleanor stated quietly. And we failed to recognize you. I was exceptional then, Arthur corrected gently, tapping the tweed fabric. Today, I was merely Arthur Pendelton, prone to arrhythmia, wearing the uniform of the forgotten. That is the lesson here. My knowledge did not change in the intervening years. Only the perception of its value did, dictated by how my boots looked on the linoleum. He thought of his years spent working in the Northern General, the sheer pressure, the responsibility. He had been a pioneer in thoracic surgery, a man whose signature was once enough to fast-track any admission. Now, he was a bureaucratic anomaly, a disruption to the smooth scheduling of the under-resourced system. I need to retrieve my coat from the cubbyhole near admissions, Arthur informed her, standing up slowly. He tested his weight on his legs, feeling the lingering fatigue from the shock, but fundamentally sound. I prefer to leave through the main entrance, if I may. I should like to see the environment that judged me one last time before I walk out of it. Eleanor didn't hesitate. I will escort you, Arthur, and I will ensure Thorne witnesses your departure. The walk back to the admissions area was strangely weighted. Where before the corridors seemed cold and endless, now they felt intensely observed. Junior staff scattered slightly as Eleanor, the matron, walked with purpose, her presence lending an unusual gravity to the elderly man beside her. They passed a cluster of administrative personnel whispering anxiously near a charting station. Arthur felt their eyes slide over him, recognition dawning in some, while others simply registered the proximity to Matron Vance as a clear warning sign. At the small, impersonal storage area near the triage desk, his coat hung forlornly on a hook. It looked even more threadbare in the harsh fluorescent light. As Arthur pulled on the worn tweed jacket, he felt a shift. not just of temperature, but of essence. The weight of the cloth settled, and with it something intangible returned. It was not arrogance, but self-possession. It was at that precise moment that Dr. Thorne appeared from around the corner, summoned by Eleanor. He stopped dead when he saw Arthur fully dressed, no longer confined by the hospital gown, looking like a man who belonged somewhere far more respectable than Ward C. "Arthur," Thorne managed, his voice strained, stripped of all previous confidence. "Doctor," Arthur acknowledged, buttoning the tweed jacket with slow, deliberate movements. "The patient you almost lost, Mr. Davies. He will make a full recovery, assuming you monitor his potassium levels closely for the next 48 hours. And perhaps, doctor, you might take a moment when you next approach a patient who looks less affluent than yourself to remember that the most vital organ is not the heart, but the mind, and that the mind does not advertise its brilliance with a tailored scrub top." Thorne visibly swallowed, his face flushing a deep crimson beneath his slightly tanned skin. The air was thick with unspoken professional rebuke. This was the necessary confrontation, the moment the hierarchy inverted itself completely. Eleanor stepped forward, resting a hand lightly on Arthur's arm. "Arthur has been extraordinarily generous with his time and expertise today, Doctor." An expertise we failed spectacularly to appreciate until it was almost too late. Arthur inclined his head to Eleanor, a small gesture of truce. "Eleanor, thank you for ensuring my departure is orderly. I trust you will handle the necessary internal rectification with the thoroughness I expect from St. Jude's." He turned towards the main glass doors. The October air outside was sharp, biting, but it felt clean compared to the stagnant atmosphere of judgment inside. He paused just before stepping out, looking back one last time at the expanse of the gleaming, indifferent hospital lobby. "I spent 50 years trying to ensure every person who crossed my path received the same level of diligent care," Arthur murmured, more to himself than to the staff watching him. "It seems the struggle continues, even when one is only seeking treatment for a tired old heart." He pushed the door open, the mechanism sighing as it admitted him into the chill afternoon of Manchester. Arthur Pendelton walked away from St. Jude's Regional Hospital, leaving behind a silence pregnant with uncomfortable truths, the faint scent of antiseptic clinging to the heavy fabric of his tweed coat, a silent testament to a day when appearance was nearly fatal. He walked toward the street, no longer just a patient, but a reminder of the standards that had been misplaced and, briefly, violently restored. Smash that subscribe button and give us a thumbs up if you enjoyed this.